So there is a framework for Medicaid states to submit to get things widened to kind of
Okay.
allow them to cover things, right? This is not just a California thing, but what we've done in CalAIM is we talked about ECM. We also have this entire kind of portfolio, if you will, of benefits called community supports. Asthma remediation and changing out the rug. That was an example of that type of community support. And with that, comes with a ton of operational nuanced challenges that if we don't solve for, it will be throwing really good money into programs, into areas that aren't giving us the return that we want. So Elvan, I think you're right on. You are right on about asking those questions in a really critical way.
And unfortunately, regulation is not one that, the words that we use, how operational nightmare, hard to scale. Like these are the words that applies to tech startups highly, right? But the benefit a tech startup has is that it operates usually with less than 10 people and you can pivot pretty quickly when you realize that you're in an operational nightmare and you're unable to scale. Well, the difference in these kind of scenarios is that it's a regulation. It took 10 years to pass it. It's not going to pivot, you know, it's harder for it to pivot. I don't want to say it's not going to pivot, but the word that you used is so well put. It needs to mature. Maturing requires pivoting.
One thing that I want everyone to kind of think about is, Marwan, how many members are we talking about in California relative to, some of the other states like a Delaware or a Rhode Island or a Utah or an Idaho? I think when you're talking about operationalizing, Elvan, I think you're hitting it on the head. But the other challenge, the number of members that Marwan is facing is of a proportion that is so much larger than in some of these other states. So Marwan, how many members do you have in California that are
Mhm.
incorporated in this?
Yeah, exactly. So 15 million members in Medi-Cal.
Oh,
Now, yeah, so it's a huge program already. The eligibility criteria for ECM, for instance, it's pretty huge. I'll give you an example. Someone is eligible if they're a high utilizer. Okay. And we know that anywhere between, let's call it 1% and 3% of an entire population, like a Medi-Cal program, is typically high utilizing. That is, they generate a disproportionate amount of healthcare claims and costs over a period of time. Then you also have people who are at risk for homelessness or who are homeless, right? And that's a certain percent. So it's a fair estimate would be that around 1.5 to 2 million people out of that 15 million would be enrolled in ECM.
Okay.
So it's a pretty large number of people.
I
So,
think that's essential, Marwan, though, to the conversation, because that number is the state total of all Medicaid membership for multiple states, not
yes.
just one state.
Something I want to explore. We're having a great conversation, but as much as there are challenges around operationalizing and also monitoring this beast of a system that's set up for all the right reasons. So there are a couple of challenges there. But I also see opportunity. There could be a lot of opportunity for innovation, a lot of opportunity for new players in the market. So if somebody who isn't experienced with California or California Medicaid program, they're thinking, gee, whatever their rationale, I'd like a slice of this pie, or hey, I think I can make a really great contribution.
mhm.
What is the system like? How do they start to get involved if they don't know that much? Let's say they're used to working in Pennsylvania. We have managed care organizations. Maybe they have a contract as a provider, and maybe they're a vendor. But how does somebody start to get involved in the Medi-Cal space in California? Is that something you're able to speak to, Marwan?
Yeah, this is a great one. I get asked this one a lot. I think the first thing you want to do is think about California again, we were talking about it's 40 million people. It's half the size of Germany, right? So you want to think about California as a gigantic market that you're not going to think about entering. You're not entering California. You want to enter San Bernardino. You want to enter Inland Empire, or you want to, or maybe you don't. Alvan, you want to find.
I live there. I don't want to enter back to San Bernardino.
No,
thank you.
But how we want to frame it is which counties, right? Which counties are the counties that will allow me to do two things: A, make the unit economics work for what I'm trying to do, and B, where can I make the most impact? For instance, if I want to do face-to-face encounters with people, right? ECM. You have to think about how you have a hub and spoke model where you're going to have an area that has a bunch of people, your staff, that get dispatched out to various people who need that face-to-face encounter. Well, it makes a difference if those people have to get in a car and travel 20 minutes versus 2 hours. It's going to cost you, there's a different cost structure. So the first thing I would think about is, let's say you're coming from Pennsylvania to California. You could probably create the profile in Pennsylvania of what county most closely mimics what I've been able to do in Pennsylvania. What county within California does that closely mimic? And start at the county level. I think people miss that. They want to enter the California market because they do the math. Maybe they need to go get some investors, and they say to their investors, there are 40 million people in this state, and here's the opportunity. You multiply this number by that number, it's going to be great. And then you get in, you realize you have so many counties with so many different attributes. So understand the counties of California, and then closely map what you want to do to a county you want to start in. That would be efficient.